Hello, this is Mike Gattorna with Health Agents Network, and today we're going to look at Medicare Part B excess charges. There are three types of providers when it comes to Medicare. There are participating providers, which accept Medicare assignment, just a regular 80/20 billing after, of course, the Part B deductible. So whatever Medicare is allowable, they bill the straight 80/20 and life goes on as normal. Then there are non-participating providers. They accept Medicare but do not accept Medicare assignment. This is roughly 4% of the Medicare providers out there, so they're allowed to charge excess charges. And then there are providers who do not accept Medicare at all, which means they cannot bill out of Medicare and they opted out of the Medicare program. These are more your concierge style doctors in most cases. But today we're going to focus on non-participating providers because these are the doctors and providers that can charge Medicare Part B excess charges. Because they don't accept Medicare assignment, Medicare says they can only be reimbursed at 95% of the Medicare allowable rate. However, they can charge a Part B excess charge of 15% above the Medicare approved amount, and this is called an unassigned claim. This actually factors a 9.25% for the patient, not the actual 15%. How does that work? Good question. The limiting charge or the excess charge is 115% of the Medicare allowable rate. But remember, they can only bill at 95%. So if you take 0.95 for 95% and 1.15 for 115%, it equals 9.25%. It's also important to note that providers can do this on a case-by-case basis. So they don't have to charge excess charges on each and every time they see a patient. They could do it on some and not other instances. They can do a regular claim without an excess charge, and that looks like this. Total Medicare allowable amount, let's say is $100. They can only bill it, remember, at 95%. So in this case, they're going to do a $95 claim. 80% will be paid by Medicare, which is $76, and 20% paid by the beneficiary, which would be $19. And that $19 will be paid by the member themselves, or the Medicare supplement carrier will pay that amount. Now, an unassigned claim is a little more complex. Same example. Total Medicare allowable amount, $100, 95% for the provider, or $95. If we apply the excess charges, it's $109.25. So it's $100 plus a limiting charge with excess charge. So let's take a look at the excess charge. It is $14.25 because we're taking $109.25, which is 9.25% plus the Medicare allowable amount of $100 minus Medicare billable amount at $95 equals $14.25, as you can see on the screen. Now, Medicare will continue to pay the 80% of the $95 or $76. The beneficiary or the supplement company will pay $19 or the 20% plus the $14.25, depending on if the beneficiary has coverage for that or not. Now, the complex part is since the claim is unassigned, the 80% or the $76 that Medicare pays is paid directly to the beneficiary, not the provider. So the provider has to generate a bill to the beneficiary for the $76 and say, please pay us the $76 that you were paid by Medicare. Now, if you operate in one of these states or are selling Medicare supplements in one of these states, you are free from excess charges because these states have actually banned on a state level Medicare Part B excess charges. Also, if you have a client who has a Medicare supplement plan F or G, they actually cover the excess charges, so the beneficiary does not have to worry about paying those excess charges. Now, if you have questions about this or more, please visit healthagentsnetwork.com.